Sorry, I think I have to be a dissenting voice. The per capita income last I checked is $2,940 per year. If affordable healthcare insurance would have been the panacea, look at USA. I've spent some time there. Half of the black people are actually turning themselves in the emergency so they can have to. What insurance covers nowadays, even with Ayushmann Bharat, is 5 lakhs. In a corporate hospital, that might not stand for 5 years. In the last, I'm as a medical student, I've been a part of the government education system, studied on a scholarship in a government school, studied on a scholarship in a government medical college, went up to All India Institute and Harvard. So I have some strong word to say. In a country like India, where 95% people don't pay tax or don't have the means to pay tax, if you are looking insurance as a solution, it is unfair, unjust. Tagore, about 150 years back, wrote in a poem called Humiliated. If you are putting a group of people behind, they will pull you down. In such an heterogeneous population, madam, you cannot ignore government system. We all have been. Now things are happening in Delhi. You have everything in an ivory tower. Go 100 kilometers away to Amroha, to Muzaffarnagar. You are not people of doing a biopsy, not doing a biopsy. So what are we talking about? What sort of? Only putting a quantity price tag on something doesn't give you quality. No, let me finish just 2-3 points. The rot starts from a very beginning. In a midday meal program, we are spending 7 rupees. And sir is right, we are glad to buy good quality clothes but for nutrition we don't have. It is a perception. Well, insurance is important, but it cannot be a panacea. My word is, it cannot be a solution for all. By strengthening government infrastructure from primary healthcare to tertiary healthcare, and especially in primary and secondary healthcare, only then you can. Because the private sector looks at a return on investment. In primary healthcare and primary education, there is no return on investment. I mean, you don't see the return on investment. So unless and until government spends money. Professor D.P. Kothari, when a Kothari Commission says 6% of the gross national income in 50 years couldn't happen. Professor Kothari was a proud student of Professor Meghnad Saha, who started this planning commission and everything, had a far-fight vision. And China has gone ahead not because they are something, because they started putting money on their primary education, secondary education, primary healthcare, and secondary healthcare 50 years before us. So, well, insurance can be one solution, but it cannot be only solution.